Now we not understanding something here. Every day I turn on TV, I keep seeing this thing called Jeffrey. Every year we got to hear about a Jeffrey. This year we talking about this Jeffrey. This Jeffrey we talking about though. He ain't your average Jeffrey. This one. What's going on here? So I'm glad my name ain't Jeffrey. God damn. Shit. Cause this man said he a working man. I'm boss man. But we gotta get this Jeffrey Epstein thing down. Hold on. Jeffrey Epstein, or whatever the fuck this is, this man, he got something to do with Trump. How that work? Trump, your boy. Your boy Trump. Yeah, your boy. When you went to that box, ones that did vote, and you knew nobody was watching, you went in there and was like, man, I'm trying to get this money. I'm trying to get this bread. You know what you was doing. And you voted for the guy. Like I said, I ain't got no problem with him now. Because there's two sides to every story. Then there's the truth. You know what I mean? So I ain't gonna knock him. I ain't gonna say I don't like the guy. But I do have some questions about the type of friends he got. Because what am I missing here? If you hanging out with people that's playing with kids for 15 years, okay, just help me understand that. What am I missing? That's all I'm asking. What am I missing? Nobody wants to talk about it. It may not even be a concern of yours. I ain't worried about this. Ain't politics. No, this is not about politics. This is that one conversation that nobody be wanting to talk about. That grooming shit. Yeah, fuckers be grooming them little girls, boy, and girls be grooming them little boys. Them women that be going to the school teachers and they go and get the kids to be their friend, and then they start buying them clothes and taking them to their house. Oh, we don't need to name no names. We just need to tell the stories. We just trying to have a reality check. Yeah, that's the new word. Reality check. We're going to have a reality check. Now, strange to me is, you had the Charlestons, and all these motherfuckers out here say they for the community. Oh, you knew I was coming, motherfuckers. These the same motherfuckers be talking about the community. Kids. Do you have your clearances? Now I need to ask some goddamn questions. Because now I got some concerns. Because how the fuck you looking the other way when they're talking about kids? Oh, I ain't political. See, this is where they get the advantage. Because, see, when they get the disadvantage, they come running to our ass. Oh, you knew I was going to be talking this shit, right? Oh, you should have known better. You got 4 years of this man. So you got to see it from both sides, the good and the bad. Yeah, it's some good. You're going to start getting the whack-a-mole, because if you work, you understand they take damn near 60% of your motherfucking money when you do overtime. So anybody that do overtime, you happy as hell that you ain't being affected by high-ass taxes on your overtime. Tips. If you drive, if you Uber, if you DoorDash, tips. You don't want that shit fucking taxed. So that's a good thing. You get old, made good decisions financially, you shouldn't get taxed on your Social Security. Those are some good goddamn things. Those are some admirable shit. But the problem is, on the back end, this motherfucker wants to cut Medicaid. And I get stuck in mud every time I say that shit. Medicaid. See, I don't make videos unless I'm at work. Let's make that shit clear. I must be paid for my time. I must be getting paid for what I do. So I'm not going to give you me for free. That's not going to happen at all, not at once, not ever at a time. So you ain't got to ever worry about somebody doing some shit for nothing. Because ain't shit for nothing. But get back to it now. I have my healthcare licensed producers. And I know that when you are a healthcare licensed producer, like the producers that make beats, like the producers that make money, you producing some shit right now. You know what I'm saying? You be getting in that kitchen, you get to work in that wrist, and you get to cook it. So let me cook. So when a person calls, you be like, hello, this is Daryl. Get your ass that Affordable Care Act. How are you doing today? Hi, my name is Susie Q, and I'm calling to do my annual enrollment. Hi, Susie Q. How are you doing today? I'm doing pretty good. I got this letter here that says that I need to do my annual enrollment. I'm 64 years and a half old, and I'm calling to get an understanding of what I have to, because they say I have to call. Yeah, make sure you know that part. They say you must call us. The federal government, call me. You're 64 and a half. You're 64 and a half, and you haven't worked in 22 years. Because you're on disability. But you call anyway. Hey, like, oh, how you doing? Good. I'm calling to get Medicare. Okay. Your name? Do you have Medicare? Yes or no? Next question. Do you have diabetes? I ain't never seen a question fuck around and change everything. This one question, when you sell health insurance, because I'm a producer, just like an engineer, when he's mastering that shit, he cooking it up with his, he whipping that shit up, he doing something. He is putting together all the sounds, the ad-libs, the trebles, the beats, the bass. He's putting it all together to make it sound one sound. All blended together, right? So here we go. You got diabetes? Yeah, okay. Yes, whole screen change. Because for some reason, the United States government got their hands in insulin. I don't know. I ain't the insulin man. I don't know what the hell's in insulin that makes it so goddamn important. That one singular question gets you transferred. Damn. Everybody else, high blood pressure, kidney disease, erectile dysfunction, blind glaucoma, liver disease, paralysis, amputee. Fuck you. If you got diabetes, this whole application changes. Boom, boom. Your ass gets sent to dual enrollment. Now, you would be like, what the fuck are you talking about, Dur? You just be rambling. But if you ain't have a job before, this shit takes time to grow. It's called protocol, procedures and shit like that. You have to follow this shit. So, what they do is, they transfer you, whoosh, go to a specialty person. Now, this specialty person's goal is to get you the most affordable healthcare. But I'm gonna sell it to you because you want the Advantage plan. You know them jingles you hear about August, November? Hey, how you doing? This is you fucking around and find out you're 64 and a half? It's time for your Medicare Advantage plan renewal, and we're here to help. And you know, you old as hell, you got a little head injury, some of y'all had a stroke, some motherfuckers just alone and just angry. But your ass still has to call. So you call, whoop-de-whoop, yeah, I'm here. I got this letter to say I'm in annual enrollment. My birthday is 10/15/1943. Okay, great, nice to meet you, man. All right, cool. This is your first time? Yeah, I'm calling to get my plan. All right, you got diabetes, so my name is Daryl, and I'm in the dual enrollment department. Hey, Daryl, how you doing? I'm good. How you doing? Yeah. How you doing today? Pretty good? Yeah. All right, well, I'm going to ask you a few questions. You got any money? On the fixed income? Do you get welfare? You get SNAP, called TAF? Oh, you do? Okay. And you said you have diabetes, correct? That Metamorphin, Ozempic, which one do you take? Okay. Generic? Oh, thank you. Any other medications? And what's your zip code? Oh, I have a Medicare Advantage plan in your area that will allow you to get over-the-counter stipend of $900, which you could pay your rent with, your food, your light, and your gas. But anyway, let me tell you about the plan. Your deductible would be $2,500. And then I'll never recover up to $6,500. Okay, great. Well, last year my deductible was only $500, and my out of network was only $5,000. What do you mean it went up to $75,000? Oh, that plan we don't have anymore. And don't you worry, because you're in a dual enrollment program, we're going to give you that $800 for your over-the-counter medication. Yeah, we're going to give you that. So if anything that's non-prescription, you want to buy excuse me, you're not hearing me. No, did I tell you that you're going to get 24 rides a year to your doctor's appointments? If you had to go to the grocery store, if you want to go to a fitness center, you can go there. Okay? Look, I just want to understand. You just told me my monthly plan is $215 a month, and my out-of-network costs and deductible costs went up. And you saying that's the same plan I had last year, but they had yes, you have a rider on this one. So not only do you have your little $500 deductible in network for your dental, but you put a rider on that plan. So now you can get dentures, you can get your crowns, because you have $2,500 to spend now, and that's in your rider. So that's why it went up. Okay, but I have diabetes, and that's why we have you as an allowable, and your catastrophic doesn't kick in. Your catastrophic does not kick in until you spend your full deductible. But my catastrophic kicks in the middle of the year, and then I'm stuck paying for insulin that's over $3,000 a month. Hey, I am not here to be. So you're mean to tell me I got to take half the insulin that I normally take because I can't afford my medication? You're in dual enrollment. You got $850 that you could take and you could go and pay your rent with. So that money that you didn't pay your rent with, you can buy your medication with. Do you realize that's the decision these people have to make as you're selling this shit to them, and they not even understanding you're giving them welfare because they're in dual enrollment. You just keep saying dual enrollment. $850 is what you get. Did I tell you get a rider? Did I tell you? So I keep talking over you, telling you about the benefits, but they never understand what the fuck you're talking about, what it come from. It came from the state. Who is the guarantor on your health insurance? Oh, you believe this guy who doesn't have a license to sell insurance? What are we talking about? So you around somebody that's giving you advice and ain't legally allowed. That's like me going up to somebody and be like, hey, bro, I need a stockbroker. This motherfucker did not have his series size 9, nothing. He ain't smart at all. He just know how to talk real fast, and he got good game, and it sound like he get money. All right, cool. He sound like he get money. All right, he don't get money. All right, I need to withdraw that money. Oh, you's a Bernie Madoff. You just cooked the books and then send me a letter to say I got all this money, but when I want to withdraw the shit, that shit don't exist. Make that make sense. Healthcare is guaranteed by your state. So say you live in Louisiana, Alabama, Tennessee. Well, if you only lived in your neighborhood your whole life, so say you ain't never left your neighborhood, you wouldn't understand that most of Tennessee, Alabama is rural. Like, it's wide open. But there's people there because everything ain't country. Some pockets have lots of people in it, but not a lot of jobs and money. And not a lot of tax paying into that shit. So who you think paying for healthcare to be sustainable? The federal government. They're the guarantor that their sovereignty. It's called the transference of risk. That's why you have a premium. You have a premium so we can transfer the fucking risk to someone else. It's a susu. You know you motherfuckers have fell for susus how many times? Every Christmas for like 5 years till you figured out a susu is a type of manipulation. There's going to be winners, my friends, and you're going to be the loser. Whoever I decide is not my friend. So what do you think the transfer of risk would be with healthcare? It's the person that has $30,000 a month in intravenous medication. Oh, you don't want to talk about cancer medication. That's why it's called dual enrollment. Most motherfucking carriers have a primary and a secondary. So the reason why you have a primary and a secondary is because you're going to run into some costs, especially as you age. So a lot of times people have retirements that cover their health care, and that's why a lot of businesses are failing. States are failing because of legacy costs. Once again, these conversations are not being had. So if you don't understand what legacy costs is, let's think of it. Drummer beat. Legacy. Legend. Long time ago, I did this with my mama and my legacy left behind this. A premium. I'm a Rockefeller and I left you all with the word called insurance. But my legacy is that I collect a premium for my ingenuity that I thought of. That's how long this shit gonna last. This is gonna be something that I get millions from for the rest of my life because I thought far enough that I made a legacy of this shit. I made it a protocol. And why I keep going back to that premium is because it's contractual. If I don't get that premium on top of everything else, I could be talking to you for 45 minutes to 3 hours straight. Blah, 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 and I tell you everything you need to know. I go through your health care. I go through your this. I go through your that. If I don't collect that premium and I don't say it is in my goddamn possession, there's no plan. So how this works is people call in November for their 2026 plan because we're in 2025 now. The deal's already been made. Negotiations have already been handled. So this year's already out. Appropriations for states to be covering costs is already been calculated to do business. The new year's coming, and that comes with a little bit of we know what to cook in the books, but now with this new president, we have a little uncertainty. And the uncertainty in the healthcare field is a big thing because go check this one out. There's this guy in Louisiana. I guess he's transitioning and Louisiana, I guess, made a decision that they would not respect people of another gender identifying the way he was. So he took his act to another state, meaning he was what they call him, a pediatric cardiologist. A pediatric cardiologist is extremely probably hard to find. Yeah, because we do doctor searches and Medicare is based off of zip codes because every doctor, you need a urologist or a goddamn butt doctor or a rectal check or something. You got plumes in your ass, whatever. You live in rural America, Tennessee, Alabama, Louisiana. Okay? Yeah? Dentists ain't close by. No. All this shit is spread out by zip code. So as you talking to your PCP or your HMO or you're going along with the spiel, the only thing you understand is I got health care. And when you get your premium, because I keep going back to this premium, if I don't hand you a contract after you hand me the premium, that is your coverage. If I don't give you a detailed list of information on what you're covered by, then that premium and that coverage is null and void. So it's contractual both ways. Okay, so that's how tedious this shit is. Just to say you got health care before you go into a hospital and you do the transfer of risk. Because all you do when you go in a hospital with an insurance card is you say, look, I'll pay my co-pays and my deductibles and whatever I have responsible for in network. But there's going to be a transfer of risk onto you to take care of the rest of the cost. And how that game plays is they collect premiums and then they go to other organizations and they sell this. I have $10 billion in insurable credit. These people pay a year in premiums. But I also run this amount of larger risk of loss because so they transfer, they make money, put their money into annuities, bonds, stocks, and market, and they allow it to grow because shit normally used to didn't happen all the time. So I'm drawing it up so long to give you an example of why when you go buy a house and you're like, damn, if I buy a house in Florida, they're talking about there's a $130,000 upfront cost for me for have fires insurance. So I have to pay that because they're not going to pay it. But you still got a premium every month to pay. But before they even give you coverage, you got to give them $140,000 to cover for fire because they don't cover fire. But this area is known for fires, and they're not going to insure this house unless you put up $140,000 to insure this house. Now, that $140,000 is in the bank accruing interest. That insurance company is not giving you that $140,000 back. They just took your $140,000 and they paid for 15 houses down your street that got burnt, except yours, because your house is not going to get burnt, like you said. But because you live in that vicinity by zip code, this is how Medicare works. You help the SUSU. You help that move along in transfers of risk. So to stay on course with this conversation is to show that Medicare and Medicaid are layered. So as this new era of 2026 insurance policies come out, because they have already appropriated everything that was going to happen in 2025, you're now going to get people on the phone, like myself, that is going to explain to you that I have no idea how it works, but there's a transfer of risk. So as rural hospitals get the news that they're not getting funding for the following year, that zip code now becomes a bigger play. It gets bigger. Because that doctor in Louisiana who didn't get the pediatric doctor in Louisiana for cardiology didn't get the respect that he wanted. He left the state of Louisiana. Now, all those children or any of those young adults that have carditis, heart murmurs, anything that has to do with the heart, they can't find a doctor in that state, but they're diagnosed as disabled. So as they're diagnosed as disabled, that automatically gives them a qualifier. That qualifier is dual enrollment. The word Medicare, great. Elderly, sounds good. But a lot of times in dual enrollment, if you get Social Security, your child has cerebral palsy, your child has mental health issues, you have a blue and yellow card. It's called Access. That is Medicare. Medicaid is the food stamp card. But if you get Social Security, SSI, SSID, and your kid running around bad as hell, and you want to slap the shit out of them all the time and give them some goddamn, not Ritalin. No, don't give me no Ritalin. What they give these kids? Adderall. Yeah, I'm talking to use the parents that give their kids Adderall. You parents, because you know they don't give black kids Adderall. Oh, hell no. They give those motherfuckers Ritalin, and Concerta. They give them some rat poisoning. But y'all who take that shit, y'all get Adderall. You Adderall parents, you actually get a check that defines you under Medicare. Yeah, Medicare. Because you're in a dual enrollment program. You have to be. Because Social Security only pays. They do not diagnose and they do not care. They are the financial guarantor of the person taking care of the individual with the disability. It gets deeper. Once you become a Social Security recipient, because you receive federal funding from the federal government, you are automatically required to fill out an application for welfare because the state pays Social Security. It's called the Department of Aging Services, the Department of Health Determination. These people determine where that federal money goes. They're the ones that determine if you get that supplement money that you be waiting on your welfare card every month after you get your SSI check. So a lot of people, you see them, they get their Social Security check, right? And then they say they got money on their welfare card because the state sends the check. And since they send the check, they send a supplement that offsets the federal government's amount that helps your cost of living and wages. So, once again, if you're not on Social Security, if you're not in no healthcare circumstances, you don't quite understand who these people are. These are everyday, really everyday people. Everyday people who are injured in a car accident, got fucked up at work, got cancer, unfortunately. These are not joking, laughing matters. These are real life circumstances that will come upon most of us unless we got some special ability to fall off the sky, hit the ground, and not blow up when the plane crashes. Don't get me into that shit. I don't know how to answer it. But these services are called life sustainables. This is not a purposeful conversation to try to legitimize somebody's well-being, their know-how to do things. This is a conversation to explain to you in grave detail how the United States government has fumbled cutting budgets and actually fucking around, and is going to decimate, destroy the healthcare system in America because you are required to provide care. And a hospital has to provide care regardless if you have health care or not. So you have the Affordable Care Act in one way that helps make it required by every insurer to make sure they insure their payees correctly, the consumer, by state law. But they are selling it across state lines. That's what the Affordable Care Act basically strengthens. The Affordable Care Act was only there to give you better options. But since this group of people like to destroy NPR, you know how cool NPR is? NPR is the shit. They got this one shit on there, public broadcasting, called Frontline, WQED, you know? They got bomb programming. I used to never had cable, and I used to watch that all day long. That is some bomb programming. Really, it's real TV. There ain't no, I'm going to pay you a check to say or sensationalize this. It's actually like, that's how it is in this country. That's how it is in this state. But the Affordable Care Act made it a way for you to be able to obtain health care basically on a platform that even the playing field to give you some preventative services at a more fair market value. So some of the things you get are free because it's at fair market value. Where before you would go to a box and they say, not Blue Cross, because Blue Cross Blue Shield is the biggest conglomerate in the healthcare market. And they're going to be coming out soon probably saying, oh, this is a quagmire. This is a hamburger. But like somebody like Health America. Health America is a shell. Health America is the payer. So you would break your fucking arm. Bow! Break your arm. Oh, broke my arm. All right, where you at? I'm on the highway with a broken arm. Oh, shit, what do I do? All right, come to my office. Okay, his arm is broke. Okay, I need you to go to a real hospital and get your arm x-ray. Huh? Yeah, we don't have that equipment here. So Health America would bring your ass in, look at a broken arm, your arm's broke. Oh, damn. Because if you go in, they would charge you because they need to approve your visitation before they let you go. So healthcare systems had a way to save money by saying, oh, we can give you a bandage. Come here. I got this. Put a band-aid on. That didn't work. And then you have people who were basically been put in these healthcare positions that weren't clinically certified to be doing the work anyway. So those became issues for people like that because they're like, hold the fuck up. I broke my arm and this uncertified motherfucker over here told me I had to drive here and in a lawsuit. Malpractice. So hospitals have to accept you with health care, period. The insurer is to guarantee that someone will pay for your care, but the hospital must provide care. So when you cut the wording, you actually cut people from having access. That's what this is about. So, you know, when you explain something, make sure you get a whole thing that these people like Charleston that told you he'd call your mama a bitch in church. Okay? In church. Like where the hell I'm at. Satan. This must be in me because I'm about to, all hell about to break loose. Call my mama a bitch at church. I'm telling you that now. Make that crystal clear. This is just let you know. One-eyed man that likes to pull his eyeballs out to get some fucking attention. And you say you for the community. Here's one for you. Articulate the healthcare system. Since you are so well versed in argumenting and debating, because how the healthcare system works is when a woman has a baby and it comes out her you know, her thingy, it becomes the viable source for the whole chain. So you keep running your mouth about negativity and coming up with these ultimate fight ideas, but when you had the microphone, you could have fueled a brain cell. You do. You had a kid call on a mama because she didn't spend the food stamps the way you said she should have spent. You didn't go through that same 9 months that she did to make this nigga. But you'll describe another person's situation about that mother to that kid to make him think he live in that situation. But you couldn't explain to that kid how that situation really happens now, today. As soon as these new healthcare rules start rolling out. You 65 and you got a broken finger. Oh, it doesn't matter. We need you on the bus. The bus got shut because they threw public transportation out. So all that rambling about how great somebody is, you just enable people to think for a check, for a quick come up, quick 5 minutes of fame. You have people sell their little bit of intelligence for humor. Before there was internet, before there was times like they had hieroglyphics, people will be alone and they be writing in the wall, sketching in the wall. If someone sees this again, they'll be able to transpose this and give it to the next person. They would leave the hieroglyphics on the wall for somebody to try to read and to figure out. But nobody is taking that time anymore to want to walk up to hieroglyphics and sit there and look at the characters and look at the different symbols and take the time to figure out. Man had stick, point stick, stab stick at object. Object looks like fire, rolls in it. That's how they learned how to cook. That's how they learned how to kill. They didn't learn how to do nothing by lying.